Hi everybody, today I wanted to talk about sciatica and then also give you some options for exercises that you can do to relieve symptoms. So first, let's talk about the sciatic nerve. The sciatic nerve is one of the longest nerves in our body, and it is quite thick. It's as thick as 2 centimeters at one point. It travels from the lower back, so the nerves connect into the lumbar spine and sacral area, from L4 all the way down to S3, the lower part of the sacrum. And then from there, they innervate through the pelvis, they pass by the piriformis muscle, and then extend all the way down the leg. So it's important before we start giving stretches and strengthening for sciatica to kind of investigate what the root cause is. Most of the research shows that majority of people who have sciatica, that it is actually stemming from a lower back issue. So before you start looking at exercises to do, you may want to think about when your symptoms occurred and if at any point prior to that you had lower back pain. So people may present firstly, they had lower back pain that eventually kind of went away and then started to experience pain in their hip, down their leg, in their knee, calf, ankle, and foot at a later period of time. So this could be indicative that the problem or the issue is the lower back, and that you may not do the traditional ways to treat sciatica. You're just going to probably look at your lower back and work on creating more space in those vertebrae, because it could be an issue of one of those nerves, the sciatic nerve. One of the nerve extensions going into the vertebrae may be compressed in some way. You may have some degeneration in your joints, your vertebral joints, and they may be compressing the nerve and causing those sciatic symptoms. The next option, maybe sciatica can sometimes root from stenosis, spinal stenosis, and in this case, sometimes you'll find that your posture, you may start to have a posture where you're more forward folding and your pelvis gets tucked under. And this is your body starting to do this to avoid pain through the spine. So in the case of spinal stenosis, that could also be putting pressure on that sciatic nerve and causing those sciatic symptoms. Another option is that it's the piriformis muscle. And when I started training, this was often what we looked at when people had sciatic pain, but it's one of the lesser causes of sciatic pain. So with the piriformis muscle, because the sciatic nerve runs right near that muscle, when that muscle is tight or out of position, it can put pressure onto the nerve and then cause pain. To kind of determine if it could be piriformis syndrome or something related to the piriformis muscle, you'll often present with not having back pain prior, and so it ends up being more into that hip, into the deep glute area. So with all that said, whether we know the cause, the root or not, I'm going to show you a few things you can do that should be good for whatever that root cause is. And what it is breathing and ELDOA. So the breath work, what we're going to do with the breath work is decompress your spine. So if it is a disc issue and there's been compression through the disc and putting pressure on the nerves, then these exercises are going to help to create a little more space through your spine. And then also what we're going to do is go back to breathing. Because a lot of issues occur within our core and our hip region because of poor breathing patterns. And sometimes it's not even necessarily a weak core, but the inability to coordinate core activation. And you'll see this, sometimes people can hold planks for a couple minutes, but when you get them to do a simple, deeper core exercise, they're unable to do it. So when muscles of the core maybe are too strong or fire too strongly, they can also compress the back muscles and the spine and then put pressure on the sciatic nerve. Okay, so let me show you some things and hopefully it provides you some relief. So we'll start off with some breathing exercises. I'm going to get you to find a wall or place your legs up on a chair or a stool. So if you're at the wall, your legs will be at about 90 degrees. Your knees can be a little closer in, whatever allows you to maintain neutral spine. Otherwise, you can rest the calves on a chair or a stool. And neutral spine is where we have the big hip bones and the pubic bones are roughly in line. It's okay if this hip bone's a little higher than the pubic bone. You have a little space in the lower back. You're relaxing your ribs down to the floor. All right, so often we develop poor breathing patterns, and this causes extra tension into the back if we're not expanding our back muscles enough when we breathe. It can also cause us to have kind of that paunch belly if we're breathing too much through the belly. And if we don't expand our ribs enough, don't get that diaphragmatic breath, our rib cage tightens, and that can also create tight muscles that run between the rib cage. So what we're going to work here is to try to expand all the way 360 degrees through that torso, or canister as we call it. I'm going to get you to start. We'll take the hands to the lower belly. And then what I want you to do is just to start to breathe. Inhale and see if you can get the air or the belly to expand. So the air obviously does not go right into your belly, stays into the lungs, but I want that pressure to come down into the belly. So inhale, you want to feel the fingers rising, and then exhale, let it go. So we're first just trying to get really deep, full breaths all from down through the body. Inhale, feel like you can breathe all the way down into the hips. Feel like you're widening the hips when you inhale. Exhale, just let it go. All right, so belly breath is great for relaxation, but we're not necessarily getting the diaphragmatic activation that we want. So the next part is you're gonna keep trying to breathe really deeply right into the pelvic floor. And I want you to take your hands onto the sides of the rib cage, and even if you can wrap your thumbs around the back, because we're going for more lateral and posterior expansion in your ribs. So now let's try it again. Take an inhale, feel the air come in wide, and then breathe wide into the rib cage. Let the rib cage expand. Feel like you can breathe into the back of the rib cage, deep into the belly. And then as you exhale, we'll let it all go. So we'll try it that way. So now we're getting deep belly breath into the rib cage, into the diaphragm, inhaling. And exhale, let it go. So we're going to add another element to it, just to counteract the thoracic extension that some people have. So sometimes they'll breathe and the lower ribs, front ribs will kind of come up, and you'll create more of an arch into the back. So now we're going to come into that neutral position with your pelvis. Inhale, deep into the belly, widen the ribs, and as you exhale, just take the hands onto the front of the ribs and draw them towards the hips and then down to the floor. Then we're going to maintain that position. Inhale again. Try to feel more expansion through the sides, back of the ribs, into the belly. Don't let the front ribs come up. And exhale. Maybe draw those ribs down to the floor a little more, and we'll keep going. Good. Okay, I'm going to show you one more part to this, a little bit of core activation. So we're going to place the fingertips on the inside of those big hip bones. Just dip inside a little bit. We're going to inhale. You're going to feel that expansion through the lower belly, wide ribs. And then as you exhale, I want you to create a bit of tension under the fingertips. So some of the cueing is trying to think about you're imagining the hip bones drawing together without too much of a hug of the belly to the back. We don't want too tight a contraction. And then on the inhale, deep belly breath, expand the ribs. As you exhale, create a bit of tension under the fingertips. Keep those ribs anchoring down. And we'll do that again. Inhale, try through the nose. Exhale. Create the tension, feel like you're drawing the hip bones together. And then let that go. So we'll just keep it there with the breathing. For this, you want to practice it about 10 to 12 breaths every day if you can. And then from there, we're going to move on to do some ELDOAs. So if you have the time, before you move into the ELDOAs, it's good to do some range of motion exercise. And that can just be leg swings, bringing the arms across and open, up and down, just to move through your joints to get the blood flowing. And then from there, you can move into these ELDOAs. So the first ELDOA we're going to do, because we talked about the sciatic nerve running from L4 to S3, is one for the sacrum. It's the legs up the wall one. It is targeting the vertebral joint from the L5, the last lumbar vertebrae, to the top of the sacrum, S1. So get yourself set up here. So we're looking at this area of the sacrum, just top of the sacrum here. Think about maybe 2 inches below the belly button, that area in the back. We're going to extend the legs up the wall. You only stretch them as much as you can without your tailbone lifting. So if you need to keep the legs bent to have the sacrum flat, stay there. Next, we're going to internally rotate our thighs. We're putting a stretch onto the whole fascial system. We're going to flex the feet, pull the toes to the face. Okay, so focus on this lower belly area and drop everything to the floor. Anchor it. Next, we're going to externally rotate our arms and extend the wrists. And then one arm at a time, take it back. Remember when we were breathing, we kept our ribs kind of drawing down and back to the floor. Keep them anchored. And then we stay here. So a few other things, you're going to look down at the cheekbones or between the legs. Gently press the head into the floor. And let's come back to that breath work we were doing. So inhale, breathe wide, deep into the belly, deep into the hips, pelvic floor, wide ribs. Exhale, a little bit of tension through the lower belly, reach the palms away from the hips. We're going to keep it here, full body stretching. And keep reminding yourself to be heavy into that sacrum. Reach the heels up the wall, pull the toes to the face. Let's try just a couple more breaths. One more here. Okay, so to come out of it, we'll do one limb, other limb, legs, and just slowly come out of that. Take a moment here and Come on to your side, press up. So that was for the connection of L5, S1. So we're gonna move it up. Next one's L4, L5, common area of herniation or compression through our spine. So this one, we're gonna sit here. So you're trying to get your spine straight and flat, straight and flat. So sometimes that involves a little more of a tuck in the tail and a little more of a drawing the space between the shoulder blades forward to get that flat position. Flex the feet, pull the toes to the shins, open your knees up wide. We're going to externally rotate like we did in the last pose, and then we're going to bring one arm, other arm up, and we stay here. You reach up to the ceiling, taking big, deep breaths into the rib cage. Stay with it here. You're pushing your knees down to anchor, and you're reaching the arms up, hugging them tight to the ears. And then look at the cheekbones or floor. Chin stays parallel to the floor, and stay with it. So the ELDOAs are held, you're working up to a minute, minute and a half. Try to do, if you can, each pose at least once, and if you can, twice. And the idea that we hold it for over the minute because it takes a while for the fascia to respond. So keep here, try to extend through the wrists a little more, push the palms up to the ceiling. Keep the eyes focused downward. Let's do 2 more breaths here. Push your knees down, pull the toes to the shins. Okay, and then very softly, slowly let it go. So proper breathing helps to kind of lift the ribs off the lower spine. So we create more space, we decompress, and the ELDOAs also have that same effect of creating more space. And as we do that, the joint's decompressed, water and nutrients can flow into the joint, and it becomes healthier. So we'll do one more that's good for if you have sciatic issues or sciatica pain. And this is L3-4. So that one's located just behind our belly button for most people. We're gonna extend the legs out and externally rotate them. So get into that flat spine position. And then we will bring it up here. We'll do one arm. It comes out wide V position, and other arm. Just turn to show you here, like that. And then you kind of judge it by the eye line and the inside of the elbow, all on one plane here. And then we stay. So focus on the area behind the belly button. Imagine you're creating space in that vertebral joint. And we stay with it. Try to draw the baby toes towards the floor, reach the heels forward, lift the rib cage off the lower back, and breathe. Keep it going. And last breath here. And then just come out of it nice and slow. Great. Good. So with these 3 ELDOAs, try them daily if you can. See if it helps you to relieve any symptoms. And I will also be showing another video with more corrective exercises coming Thanks for joining me.